I've been thrilled with my result. The thing that really has surprised me the most is the contrast difference. My iPhone has much better contrast. The clarity is better. I can see that well up close. My distance is even better. Having my vision restored after the cataract surgery was wonderful, much less dependent on glasses. I can see my watch great. I can tell the date, the time perfectly, the degrees outside. I can read my calendar on my watch. It's really a thrill to have this done and then have the ability to adjust it afterwards to bring it right to perfection or the ideal power. This is a lens that I studied about, and I remember making a presentation in 2014 to a large group of people about this lens. At that time, it was known as the Calhoun lens, and about 5-6 weeks ago, I had it done. I've been nothing but thrilled. We can adjust it to whatever focal length that we would want to have. We really couldn't do that in the past unless we fine-tuned it with LASIK or glasses or a contact lens, because this implant in particular is adjustable. And I love that adjustability factor, and it's like having a safety net below you so you can reap the maximum vision for your eye. Having had RK, I'm thrilled to be where I'm at and to have the light adjustable lens. I have a little diurnal variation in my vision, which is normal for someone that's had radial keratotomy. One way I would compare the light adjustable lens is that you're able, after you do all the calculations, you implant it and the eye settles. There's a certain amount of settling that goes on where the vision will vary in the healing period. And with the light adjustable lens, after things settle, you can place the focal point exactly where you want it. And I would liken this to throwing a football to a receiver in the end zone. Let's say you're 5 inches off, he can't catch it. Well, you just go in and adjust the throw, and you make that throw 5 inches towards his hands or his chest. It's the very latest technology, and Dr. Nasser excels, and he has everything you would need here right under this roof in this office. Dr. Nasser and I decided that this would be the best for me. And that's something that each patient Dr. Nasser will take you through the process and point out what advantages each of these lenses has for the individual patient. Surgery was very easy to go through, a breeze. It was painless. I just saw light and I was very relaxed, and I knew I was in good hands. I taught surgery to other doctors for over 20 years at Southwestern. I taught them cataract surgery, and what I really enjoyed about what he had the femtosecond laser that helped remove the cataract. And that made the first half of the cataract procedure the closest to perfection you can get with the femtosecond laser, because it's so darn precise, and made it safer. We put the adaptive lens in, the adjustable lens in, and that is serving as my ace in the hole. And I'm thrilled with my vision the way it is right now. Highly recommend him. He is the man. And he's very patient, very calculated, very meticulous, which I love. I was the same way. I could have chosen anyone, and I chose Dr. Nasser. I would do it all over again, exactly the same way.